So how do you decide on which bariatric procedure or metabolic operation you want to have? It really just depends on what your goals are. Maybe you're only a little bit overweight and need some help, in which case I would recommend highly considering one of those bariatric procedures such as the lap band, the endoscopic sleeve gastroplasty, or the gastric balloon to help support you on your journey. Perhaps you have metabolic disease like type 2 diabetes, high blood pressure, sleep apnea, and maybe your body mass index is 35, 40, or 50 or greater. The higher your BMI, you may benefit from one of our more aggressive metabolic procedures, such as the SADI or the duodenal switch. My personal experience is largely with sleeve gastrectomy and gastric bypass. I'll tell you a story about a couple. The gentleman in the couple had a sleeve gastrectomy and the wife had a gastric bypass. She had type 2 diabetes and he did not. Within a year after surgery, they were both living a full life together. He was a hunter and she wanted to go hunting with him. They'd wake up at 3, 4 in the morning to get ready to go on their hunting adventures. But the only thing open that early in the morning was a 7-Eleven service station. Him having the sleeve gastrectomy would choose the breakfast burrito. Her having the gastric bypass would try to eat the breakfast burrito, but she would get intensely sick and throw it all up. I think this really highlights the differences in what a person needs to engage in terms of what they're eating in order to make sure that they have a really healthy experience after surgery. Both patients lost a lot of weight and were able to maintain it, even if they ate the random 7-Eleven breakfast burrito. So it's not about being perfect, but it's about really listening to our bodies and acknowledging that processed foods, when they go straight into the intestine, like in our intestinal bypass operations, gastric bypasses, duodenal switches, and the SADI procedures, you don't really have the wiggle room to live a comfortable life eating those foods. So really, have a conversation with your doctor. All of these options are on the table, and we want to make sure that you choose the best option that's meant for you. I also have another disclaimer, and that is the stomach is a muscle. It will stretch over time to accommodate more and more food. And we want it to do this. Because if you were to live your life with the same restriction that you had right after surgery, you would be very malnourished. The stomach does stretch to accommodate the food that we put in it. So you will learn in future videos what that process looks like, increasing the amount of food you eat right after surgery, all the way up to a year out from surgery. Just like my patients, if they were to eat a 7-Eleven breakfast burrito every time they went hunting, first month after surgery, it wouldn't work. They would both be vomiting and choking.